Hello viewers, I'm Dr. Naidu and welcome to my channel Dr. Naidu's Dent-Align. Today I'll be sharing some very interesting facts regarding the responsibilities of a braces patient. All braces patients want a wonderful smile, but can you get them only with the effort of the orthodontist? No. There are some few tasks which the braces patient has to take responsibility among himself or herself to execute them during this entire course of treatment to ensure a wonderful result. Come, let's see what these important and responsible tasks are. The first important responsibility is they need to report to the orthodontic office regularly as prescribed interval by the orthodontist, that is 3 weekly or monthly intervals. Second is there are some dietary restrictions. No, don't get afraid. There are no, weight loss diets here. You can eat as much food as you want, but the consistency of the food is very important. You need to avoid things which are very hard to chew on, very sticky to chew on, and which are very crunchy to chew on. So hard food items and crunchy food items like chikki, chakli, eclairs, 5-star, these are sticky. Popcorn, all the dry fruits like peanuts, walnuts, pistachio, all these need to be avoided or need to be converted into soft to be consumed. Also, you have Tilgud Ladu, which is a big villain as far as the braces go, and they hit the braces hard. So avoid them. Okay? Pani puri, all the puris are hard. The samosa, the hard part of the samosa should be avoided. Also, a lot of these farsan items have these hard sales which need to be avoided. You can convert any hard thing into soft by grating, crushing, grinding, and then mixing with water or milk or spread it over your food to consume that. Even raw food needs to be cut into fine pieces. The food needs to not be bitten from the front teeth, but with a knife, very fine pieces loaded onto the back teeth and chew. The third important responsibility, you have to be very vigilant about your braces. You need to see each day in the morning and in the night whether all your braces are intact in the mouth. Okay, so count all the braces that are stuck at the start and ensure that all your braces are all in perfect position. If there's any breakage, any loosening of braces, immediately report it to your orthodontic office. Similarly, fixed retainers are also given to our patient at the end of the treatment. These fixed retainers also need to be monitored for any loosening or breakages. Report them as soon as you notice any change in their way of attachment. The fourth important task is to wear your elastics well. Elastics are these kind of colorful rubber bands that are given to the patients during a particular stage of treatment. These have to be worn both correctly as well as sufficiently. So, and the orthodontist is training you how to wear your elastics. Get trained perfectly. Give sufficient time at the office to master the technique of wearing the elastics. And it has to be worn for a sufficient duration of time as prescribed by the orthodontist to follow it diligently, otherwise it does not work. Now these were all as far as the fixed braces patients go. But what if patients are on retainers or they are on some removable appliances or they are on some aligner therapy? So these appliances which are there like these are retainers which retain your correction at the end of your fixed braces treatment. Okay, or aligners are appliances like these which are removable but they also move teeth. Now these move teeth only if they are situated or placed in the mouth. If they are out somewhere on the table, on your dresser, and you have gone out to your school, your college, your office, it's not going to work. Ultimate responsibility of these are in your hands. You need to be compliant to wear them with a sufficient number of hours of 22 to 24 hours a day. Most important task is to keep your braces and your teeth clean. Maintaining oral hygiene is very important, and that has to be performed with the help of these two brushes as far as your fixed braces go. So this is an interdental brush called Proxa brush. It is used in between of the braces. all the food particles are loosened out. This is done in between of every single brace here. Okay, so this has to be done in between, and then do your regular brushing. I generally recommend Colgate zigzag medium bristle brush. Medium is very important for dislodging all the food particles. Clean on all the surface of the braces, on the top, underneath, and the rest of the surfaces of your teeth. Always visit your orthodontic office with a very clean mouth. It has to be freshly brushed, and only then you go to your orthodontic office for your treatment. Not only your teeth have to be kept clean, what about your retainers and your aligners? They also need to be kept clean. So a similar brush, but soft bristle brush, can be used along with soap water. That is liquid soap or your cake soap water, and just brush it gently. Okay, twice or thrice in a day. Also rinse your mouth frequently to ensure that no food particles are constantly stuck in between of your braces. So if you maintain this hygiene of both your aligners and your retainers and also your fixed braces, you will have a caries free mouth, and your teeth movement will be fast, quick, and your orthodontist will be able to work very efficiently in your mouth. So these are basically, I have outlined the responsibilities of a responsible braces patient. So I'm sure if you would follow this, you will get a great result. Thank you.